It doesn't look like anybody since it's online. David, do you want to start?
City Administrator, City of North Bend.
Jessica Inoki, Meredith Markman.
Diana Pedregon, and I wear various hats in this community. And my favorite right now is the DKD clinic. I'm a volunteer there.
And John Speed, one of the county commissioners.
Bob Moore, Football Indian Housing Authority. Thanks, John.
Jody Hoffner here. I'm just a citizen trying to learn more about this.
Can you, sorry,
Tom
can you-
Brown,
Jody Hoffman, I'm
Jody,
a citizen just trying to learn more about this.
Tom Brown, citizen, Coos Bay.
Nancy Brown, citizen, good.
Drew Farmer, Coos Bay City Council.
David Geels, I'm representing Coos County.
And Nicole Rutherford, City of Coos Bay. Andrew.
Mr. Brainer, Director of Rules Response. He's speaking.
Okay, so I think that catches everybody. The first thing on our agenda is public comments. If anybody would like to add anything to the meeting, you're welcome to do so at this time.
Not at this time,
Okay,
at the end of the meeting.
well,
Public comment would be now.
yeah,
Yeah, I'm curious. I'm trying to follow this process as best I can and to be actively engaged in it. I would like to know what specific priorities this board has established for Andrew to carry out. Because I'm not clear on them.
Great question. They're all listed in the adopted strategic
I
plan.
know the strategic plan. I've read it, I've reviewed it, I actively participated in putting it together. But I don't know which elements of that plan Andrew has been charged with carrying out. Is it carry out the whole plan? That seems a little bit unrealistic to me. So I'm curious to know, for example, between now and the end of this calendar year, what is your strategy for having accomplished elements of the plan? That's my question.
so we have a couple of projects that we are working on. We put in a funding request to the state. So that is our like immediate goal, funding and then moving those projects forward. That will also require likely that we're going to have to take some other steps. And so today, as part of the agenda, we have some additional support staff that we're looking at potentially adding, which would be an administrative person who can help with some of the paper and process. And then also a project manager, which will help kind of drive some of these specific projects forward.
I guess if we step back actually. So communication, collaboration, and then implementation. So all of the groups that have been brought forth, all of those, and if you've been at those are collaborative meetings. Okay, so we're still in the information gathering. The collaboration was when the balance of funding from the executive order came out. All of the providers were contacted. We collected and gathered data. All that is facilitated. We then he compiles all of that, brings it back to the group here. We then utilize that to submit, and we will have a report on that momentarily. Aside from that, right now we're focused on that because it's funding. And as Nicole said, he has worked to vet all of the grant writers so that we at the last meeting selected a grant writer. We then have gotten to the point where we are today. He does all of the administrative work, which gets us where we are now moving forward with a recommendation for administrative assistance and project management. So those are all the things that are collaboratively going that are all tied back to the strategic plan. He's also working to have the strategic plan blown up. So probably in a week or so, you'll come in and actually all these walls will have the strategic plan. And that will then have every effort that we do has to be tied back. So there's nothing that this gentleman's doing that's not tied to the strategic plan. And that included, for instance,
That was never a question.
no, and I'm not that saying, I'm saying there's folks here that have no clue of background. So I'm actually expanding a lot more because I know what meetings you're at. And so, for instance, the collaboration was exactly why he did the ride along and was encouraged to do the ride alongs with the community resource officers. So he's actually out on the street interacting and seeing what is occurring, what the needs are. And we've asked him to do that with other organizations as well, so that the office itself can best reflect the needs of the community and then tie them back to the strategic plan. And so he spends an awful lot of time doing information gathering with all of those continuum care entities. You then have 6 members on the actual advisory. 3 of them are administrative, 3 are elected officials, so we bifurcated that. And so the administrative folks are the working group. We meet every single week. Then once a month, we have the entire group that meets, and then that's where the decisions are actually made. So the work product throughout the month comes to this meeting, and that's where the advisory board members then make decisions, and then we can continue to execute those. David, you want to add anything additional?
Well, I mean, I think the initial focus has been to draw down dollars, to have the plan in place. I mean, that is something where there's a deadline that we need to move, and a lot of organizations are going to depend on that funding for moving some projects forward. So I would just say that briefly, I think that's been one of our primary focus, and ask of Andrew to help us with. Some of the other efforts are longer term, right? I mean, they're not one and done, they're longer things, especially some of the coordination around needs, things like that.
So my follow-up comment is that what you've said are all action steps to help implement the strategic plan. What I haven't heard and what I'm curious to know is, have you as a group identified any larger goals that you hope to achieve?
We cannot go outside the scope of the actual strategic plan without the adoption. So when you say larger goals, right now,
Larger goals of the strategic plan.
we have those. In fact, they'll be talked about today. So that was the exact reason why every single person that is a partner was actually surveyed and asked for data, because that is moving the larger goal. And the goal will be updated later on the agenda, which is the goal of those 34 heads and beds, if you will. Which is our county's goal through the executive orders of the governor.
Thank you. I think this discussion helps frame better the work that we're trying to accomplish.
And then I also just would add, I think this last round of, I don't know, landing stakeholders, because we've been using that, maybe that's not the right
Community
terminology.
partners.
Community partners.
Yes.
Andrew, sorry. Has been directed to ask specific questions, identifying elements of the strategic plan that those partners see themselves fitting as a piece of that. So, and as we find that out, we're again, it's data gathering in order to kind of from that decide which steps we should take after this big one is hopefully resolved. Does that open any other questions for public comment?
I'm excited for results, get results.
Yeah, we are too. We are too.
It's a long discussion.
Yeah, I mean, I guess we would just add to that, and you probably already heard this, but if there was an easy answer, we wouldn't be here today. And this is a nationwide crisis, so it just takes some patience, and just we got to roll our sleeves up a little bit, so.
And then I guess the best also to sort of, and like, we're not the only ones working on this, although we're the coordinated. So we also coordinate with the Housing Action Team, the Housing Authority, other strategic partners. There are a whole lot more additional meetings well beyond that have tentacles into this organization. So for instance, when the city of Coos Bay or city of North Bend or the county are working on housing projects, we are coordinating efforts, but it is not necessarily discussed at this table, because ultimately there are certain things in the plan where this group cannot accomplish without those community partners. And so we coordinate and communicate with the strategic partners to actually get specific goals accomplished And that's why all the community partners were involved in developing the strategic plan. We knew that we couldn't pull it off, but what we've done initially is break down the silos and open up doors of communication, and more importantly, knowledge that otherwise we had organizations that were basically duplicating services or did not know services were available that are actually finally talking to one another. We just had a great meeting with the faith-based stakeholders, and they actually want to get involved to help, and that's not occurred, at least in my tenure here in the community. And so there is a lot going on, but it's not all going to go through this group, and there's reasons why it won't go through this group. There's a lot of other organizations that also have governing bodies, and so we coordinate all of those efforts.
So I have a question then relating to that. Are you guys, is your primary objective to find where it's being duplicated, where the needs are, and increase efficiency, or do you guys actually get a basket of money to distribute to get it done?
So we only have $1 million, and that is supposed to be spread over 5 years, which means that $1 million has to be laddered to be able to bring in additional money. And so, for instance, at our last meeting is when we hired a grant writer or executed, and we're in the process of getting the county and that contract through so that they can actually start going and getting money that can then help organizations that have an end result that help accomplish things in the strategic plan. Then again, another thing that we'll talk to about today is the executive orders and additional money that will come into the community. Folks think that the money all drops on us, and it doesn't.
Yeah, I was expecting pizza.
Yeah.
Clearly put that in the header.
Yeah. You can all share what's left of the mayor's election. But the reality is we've been very, very frugal with the money because $1 million goes very, very quickly. And we have not spent much of that. Everything has been trying to be strategic. And you can't just throw out money until you know what are the needs, do they align to our goals, and then how are we going to make sure that it's sustainable over 5 years? Because the $1 million for each of the pilots in some communities much larger than us, that doesn't go very far. And then we're on the hook collaboratively for years 3, 4, and 5. And so I lost the reason for the grant writer and the project manager so that we are the best stewards of what we have. And all of the other agencies also bring resources to the table. And so again, they're cross collaborating. And so we have a lot of strategic partners, community collaborators, community partners working with us. I even said that word. The state wants us to stop using stakeholders.
For the duplication, there's a software that's been rolled out by the feds that now applies in the state. It was Connect. Unite Us that rolled into Connect Oregon, and that is a component that should be managed through this office as well, or observed. That software is to track what agencies perform what duties and then make it easier to identify where there are duplications, and then through this office coordinate efficiencies of application to use the dollars more effectively.
Yeah, but keep in mind, we're an advisory organization. So although we work for government, we are not the government. Therefore, we rely on the 3-member governments to implement policy at the local level to actually affect change. What we can do is coordinate, collaborate with our community partners in order to affect that change. And then there are various funding buckets that come on, and so those can be incentivized that, for instance, this is a worthwhile task, it'll help meet the goal. And so we can provide grant writing services or administrative help or program management in order to help affect the end result. Because what we have learned is most of the organizations, our community partners, all lack capacity. Capacity is the biggest issue, and so Folks can volunteer as much as they want for the organizations, they'll gladly sign you up, but it's a capacity issue. And so trying to share as many resources as we can is critical. Hopefully that answered all the public comment
Yeah,
questions.
there's a lot of, still some more backstory, so we can definitely chat. Like, because I think the rest of the folks have been here and are aware of that, so we can, you know, afterwards, if you want to get a little bit more information, I'm happy to share.
I've been to some of the meetings in North Bend where they talked about, you know, the rulings and stuff that they have to go by to.
Yeah, so that's part of the larger picture, for sure. If we're good with public comments, we'll move on.
Now it's like council.
Oh, sorry. Stephanie, would you like to share?
Oh, I'm Stephanie Kilmer, the Coos Bay City Councilor or Council, and I serve as an alternate to the school, so I try to attend, so I can keep that. What's happening?
So item 3, balance of state funding request updates.
All right, so for the benefit of the advisory committee, and I'll give a little additional background. So the balance of state executive order was for 26 counties. There was 26.1 million. They asked the counties to figure out how to collaborate and work with one another. And we had raised our hand and said, we are an established House Bill 4123 county, which is where the $1 million came from. We had already had an adopted strategic plan. And so for us to bifurcate and try to work with other counties and that would have been pumping the brakes. And then we would have basically had to stop everything, rejoin forces. And then the state alerted us that, oh, by the way, there's a very short fuse of which you have to gather all this data and put your projects in the hopper in order to get reviewed for potential funding to be doled out. They also used a funding formula to figure out what each potential county would be eligible for. Ours was in the neighborhood of just shy of about 1.5 million. Hold that up a little, you know, with interest. Like they're gonna give us the interest. And so we had submitted, compiled, we asked all the agencies to come in. There was only a handful of agencies that actually submitted, which was unfortunate, but it was a huge amount of tasks. Again, a lot of these community partners do not have the resources, nor are they actually regularly collecting data, which ultimately would help them. And so it was a very educating process. Meaning, for instance, you know, what's your programming budgets? You know, what are your actual heads in beds? You know, how many do you have available? What do you have in the pipeline? It was a very, very long document. Those that did submit by the deadline, all that data was compiled. Once it was compiled, Coos Bay North Bend collectively worked together on a final compiled document. We had worked and vetted potential projects. There were 3 what we considered to be shovel-ready projects. All 3 are Nancy Devereaux Center projects. There are other projects that are coming online, but the state wanted shovel-ready projects that would meet a specific goal and specific allocations for heads and beds. Our county's allegation over an 18 to 24 month period was to, if we're going to assign any funding to you, that we want to know that you can achieve 34 additional spots within that 2-year period. The Nancy Devereaux Center has several facilities either under contract or that they have purchased that are in various stages of completion. And so each of those, we knew that within a budget, if funded, that we could get those projects funded and move forward. The state said that we could not submit faith-based organization projects that they had to either be a nonprofit or they actually had to be a continuum of care direct provider. We submitted all of that. We went through a technical review, exhaustive, about 3 hours, where they questioned just about everything on ours. We got very favorable reviews back from our plan, and that is the Coos Bay North Bend Coos County community plan. That plan is tied straight back to the strategic plan. We are working this week because the numbers of heads and beds did not meet the 34. And so we had a impromptu meeting with those that did submit data back to us. I believe also there, let's see, we had the Salvation Army there, we had the Devereaux Center there, we had AYA there. Operation Rebuild Hope was there, Coos Bay North Bend. We then had a follow-up technical assistance call later that day. And then over the last 2 days, we've gotten technical assistance back and forth, and we've gotten everyone's questions answered. The state agrees that the Devereaux Center's projects are the projects that will actually get heads and beds and meets the governor's goals. The Salvation Army's projects potentially can be in a second tranche, but are not shovel ready. They believe that what AYA is doing also helps meet the goal, and they've encouraged us to go ahead and update and revise and incorporate those to do the balance of the 34. And they said that Operation Rebuild Hope does not meet the definitions of the funding for their available beds because they are
Targeted
short-term population. And so what they want is they want long-term commitments. And so that's not a negative against Operation Rebuild Hope. It's just their model. Actually, what they want is, and I'll give an example. If the mayor here was homeless, I could either find her an RV park or an apartment, or I can find her a bedroom in a house where she doesn't have to worry about where she's going to sleep next week, next month, next year, basically over an 18 to 24 month period. And so as long as there's an actual commitment, that person truly is no longer homeless, then they can be counted in the program. And so in the case of the state, they believe the model's actually reversed of how they're operating. And so that's good feedback, and we provided some of that feedback. Is that they feel like, but I understand why. It's Operation Turnkey, and there was existing.
Yeah, they've moved towards the housing first model, and they want to get people into houses when there's not enough houses.
Exactly.
So they stop looking at shelters, which helps nothing.
Yeah.
Second question, did the state indicate that this is an equal allocation? That are,
It is not an equal.
Okay,
It is a formula based.
so if an organization submits, has something that can put more heads and beds.
It is a formula based, and so they have created the formula of the numbers for how many heads and beds within the balance of 26. And then they did a formula based the allocation of what they think, and it's never enough money. I'm going to tell you that flat out, because our allocation is just shy of 1.5 million for 34 that would have to be housed over a 24-month period. And so you have to be able then to strategically. And so the question that comes up is, okay, what's our operational costs? How are we going to cover those? You know, how are we going to make sure that it's sustainable so that at the end of 24 months, they're not. And those are the tough questions that we had to ask of all of the partners. what is the plan? And then that's also why we are layering it. So you have to think of it as like with the Devereaux Center. They have the Coal Bank Village, and you have to be able to then migrate them into, say, some transitional housing, so that then ultimately they can get into a rapid rehousing, and then hopefully protect, permanent supportive housing. And so you have to work with the housing authority and all of these other programs that potentially can achieve that. Once we, today, I know that earlier today, I did a recast or rewrite. I'm waiting to hear back from AYA of their document, their plan, and trying to make sure that we're putting our best foot forward. And then also, as part of this, we get to capture what this group gets to capture is, what are folks doing? What's it gonna cost? What are the goals? And all of that helps us then, because the project manager, the grant writer, then can start going after additional funding, because we're going to have to collectively work together so that we have a long-term plan. We will update, revise the numbers. Nicole sent me back the plan with some additional numbers. I do my gizmo work to it, polish it off, and then once we're done, we'll resubmit it. The state wanted it resubmitted this week. The nice thing is that they were extremely favorable of what we did, where we are, what we've accomplished. They really liked the story, the sort of, because it was easy to be able to pull things up and show them firsthand examples of opportunities. I shared with them, for instance, the Devereaux video, which, by the way, the Devereaux Center, is working in Florence. And, after reading the article, I'm like, they just show them that video, a good video. The Devereaux Center, is doing great work. They have a lot of stigma. My wife is she volunteers there. She's their development director. And so, for full disclosure, but there's no conflict of interest, because the state says that it's a nonprofit and she doesn't get paid. So so I throw that out there so that you know. Because everyone I've seen online, it's conflict of interest. She doesn't financially benefit, so if they get funded, no, she doesn't. So we're good
On her for volunteering, right? That's
Mhm.
shame on her for volunteering.
Well, I'll say, and I know it's recorded, so I'll say nothing I wouldn't say there. I told her the day, it's like, I know whether not to hug you, congratulate you, or slap you. But since I don't slap women, congratulations. But it's a calling for her. And then I asked her, I says, well, do you mind using your maiden name? That didn't go over too well. But I'm very proud of what she's doing. She was very integral in the strategic plan. She is the one that went out to all of the faith-based organizations in the county. And I'll tell you, they offered her $50 an hour, and she was excited. And then she called me and said, you can't accept it, but you can volunteer. And so she has volunteered for the chamber. She's volunteered in your visitor information center for PCB. She volunteered at the pool. She does, God bless her. I love her for that. But she also takes a lot of heat online because she's doing good work. It's unfortunate. So that said, let's get back to the Devereaux Center. The projects are, they have the Azalea House, which is mental health, and it's a program where they will have I'll call it a caretaker, if you will, that's on site, sort of like a site manager, but it's not, to my understanding, providing direct services. They're sort of just making sure the house runs the way the house is supposed to run. It's over in Thompson. It's about 50% renovated. I think they just got the permit, I'm told, for concrete. So apparently that'll be moving forward. And so, in fact, that's just up the street from my house. Because I always wonder, it's like, what is up with that house? And little did I know that everyone said around it.
Just a word about that. That project sort of illustrates the group nature that property was donated by a community member. We're also providing for mental health grant, we're providing some of the funding, but it also is a little bit short. So
Exactly. Yeah, gap funding. And so we submitted that because at the end of the day, it's got to get operational. And so what most of you don't realize is, for instance, like under mental health, the hospital tell you that, you know, they have nowhere to actually release some of their mental health patients to that need temporary or longer term housing. And so they struggle. So it's all about having the partners at the table. The second project is over on Wasson. It is a triplex. No, it is a house that was modified, and now it's like 2 houses, maybe like a duplex and a house. Yeah,
maybe.
and they may not have actually gotten permits back when they modified it. So this house, their goal is to renovate it and then work with the city on any necessary permits so that it is brought up to code. And so they had gotten grant funding and were able to purchase it, but they have gap because they also now have to renovate it. And I think on the funding, they were about 86,000 short on the purchase. But so all that gets worked out, and they'll be able then to transition homeless, you know, graduating from say Coalbank Village into housing. And then ultimately the goal is then to be able to get them to independent housing. Yes.
I had a question. The tents you put in will be able to buy it, and that they did buy it. Which one is it? The triplex.
It's purchased.
It's purchased, yes, they purchased it. They own, one was donated, the first one was donated, the second one was purchased. The third project is basically an expanded Coalbank Village project. So the goal is to take the very successful model of Coalbank Village and greatly expand it and be able to have more shelters. The issue is under time, manner, and place, which is a separate House bill. No one can enforce or heavily regulate homeless on the street unless you actually have a shelter. Okay, and so under all of the case law, folks can sleep wherever. And so the goal is to be able to get shelters and then be able to have wraparound services and then ultimately be able to migrate to otherwise supportive housing or permanent housing. So those are the 3 projects. They either have them donated, purchased, or under an option to acquire if the funding comes through. That way they're not overloaded. Yes, sir.
Since there's no additional space to expand Coalbank Village, do they have another site identified?
Yes, it is under contract. So, yes, sir.
A lot of these folks are on social security and mentally unstable ones, and they probably need people to handle their money or whatever. Are you guys going to be involved in anything like that?
We are not. We don't get involved in the guardianship, but the providers that we work to, they tap them with resources. And so we are doing a coordinated effort. And so, yes, there are organizations in the community that we're working with that assist and help with that.
Coos Health still does that, right?
We do, and you know, as Andrew can speak to, we have that group of health providers that have come together, because those are the folks that are likely going to be doing this. They're already doing it, and they'll be doing it in our expansion. So with the expansion of Coalbank, yes, we would, Coos Health and Wellness would be involved. Adapt, area First Step would also be involved. Advanced Health on the health side would also be involved. Really, the same partners that are involved in the current operations would be involved in the expansion.
Coalbank is long-term, so it would qualify for this program, or is it short-term?
Coalbank can go up to 2 years. Yeah. and also does emergency housing as well, priority housing. But more importantly, they have case management and they also have wraparound services. And so it is, it's not a unique model, but it is a very successful model.
I think that's a good point though, because, you know, we are focusing sort of on the first area, which is shelter and emergency housing. But for us to be successful long-term, we can't stop there, right? We need the other housing options that allow us to help move people into more permanent options. So, you know, this is a start, but we have to have the other pieces in place and moving forward if we're gonna have.
If you were expected to make 34 beds with $1.5 million, how many were you able to figure out that you could make?
After Monday's meeting, we have all 34 accounted for. In fact, we exceeded, but under guidance of the state, they said, do not exceed. They're like, if you break that, that's great, but we want to see 34.
I think that's amazing that you're able to develop 34 beds.
And I guess maybe to add a little bit of clarity around that. So the 1.5 is the allocation formula, which is intended for operational costs. There is a second set of dollars that will be competitive, but it is slightly competitive. That will fund those capital projects. So
that sticks more the sticks there.
yes.
Yeah.
Yes.
So those 3 projects have been submitted. They have all been defended, if you will. So they are they're on the radar. Everything has been favorable because of the overall collaboration that's occurring here. And so, for instance, you ask about, 34. And what's the next step? Well, we're working aggressively, helping the Housing Authority, for instance, on an appeal for its Bangor School project, which is low-income tax credits. We are working with AYA that actually places individuals in private homes.
What is AYA?
Alternative Youth Authority.
Activities.
And so, yes. And then the local governments are constantly working on housing. Coos Bay's working on developments, or Ben's working on developments. And so there's an entire spectrum. I had a woman come in last week. She has Social Security. Her husband's passed. He was an orthopedic surgeon, makes just over $3,000 a month. And doesn't qualify for any of the programs because it shows that she makes too much. If you take $3,000 a month, that's $36,000 a year. You take it based on 40% for housing. Show me what's affordable, that you get for $1,200 a month here in Coos Bay North Bend. And then you just gave an example at lunch of how large was that nice, beautiful bay house?
494 square feet, 1 bedroom, 1 bath. I thought it was a shed. Posted last night for sale for $190,000 in North Bend. I did 2 probably people out of state saying, come to the coast for a cute little cottage. 190,000 for shed, 450 square feet or so.
Yes, sir.
You had mentioned that the state encouraged us to involve AYA in this plan, and so are they part of the 34 bed count, or are they not part of the?
Yes, they are. And so the state did not encourage us to involve them. What they stated was they encouraged that those that were submitted, those that came to us with data,
Yeah.
and all of the survey data back that were included that showed that they were part of the solution, to include and move forward in the application.
So they'll get part of the money?
Potentially, yes, they have a request in, and so those organizations will be vetted. So we have a plan, and as Nicole said, there's 2 tranches. So the 3 projects are capital projects. So aside from the rounded up 1.5 million, and that those funds can go to operational costs, paying rent. In fact, through this process, we learned that if there is someone living in an RV and has kids, for instance, if we can find them a spot in an RV park, we can use the money and pay their rent for 2 years and get them off the street so that therefore, they're not out there getting ticketed and things. And so there's a lot of things that are available to us. The capital projects will be at the discretion of the governor. We are doing some aggressive lobbying to try to make sure that ours stay up front and that they are truly shovel ready. And there is only a mere 6 million, although she has access to an additional 20 million in the first tranche. And so we are constantly making sure that our projects stay on their radar. And so that is the status of where our collective efforts are on that.
Thank you.
David, can you give some specifics about the numbers again that bring us to 34? How many in the Azalea house? How many in the triplex?
So it kind
What's
of
the
varies,
proposed expansion?
because it depends if, for example, the houses could have a family,
Yeah,
which is kind of the intention, and that family could be a 3-member family or a 5-member
I
family.
see.
So we landed with 15 for the development projects, and then,
17.
well, the total was 15, and then,
So the other two though. The rain.
Yeah.
So we took the lower number.
yes.
Yeah,
the
okay.
low number, and then, so then the balance is with the AMAs projects, and a
So
number.
the three Devereaux Center projects give us 15 beds.
Yes, I mean, there's more beds than that potentially, but that's the minimum, I guess, that we would land at those sites.
What would be a pullback expansion be numbers?
So the Colbank fits in a different, for the pilot shelters are a different number, and we had that around 34, I think, was those numbers, so. But those
So
don't
we
count
need to-
towards
We
the,
legally need the benchmarks
Yes.
of those projects.
Then after those 15, the other 19 were AYA.
yes,
So for folks, alternative youth activity is for kids that have exited the traditional school path, frequently at youth risk or at-risk youth, homeless kids, and it also incorporates a trade skill program to help them
and then kids
develop
too, I
skills to
think,
be
that are
independent.
aging out of.
Yep, kids aging out of foster.
People from Second Street?
Say again?
Are they the one on Second Street?
No, they're on Main Street in Coos Bay's Empire. They're tucked down a gravel road.
They were next to Blossom Gulch several years ago.
AYA was?
Yeah.
Oh, okay.
Yeah, they've been in North Bend too.
My history's not that good on AYA, apparently.
They've been off in Empire for years.
A while, yeah. Go back.
So
They've
they-
got a long history.
Oh, sorry. They also don't just work with the alternative youth, like that they've gone to their school. They also do other work with other families too. They don't necessarily have to have attended their school.
Yeah.
Agree, do all kinds of stuff.
Yeah, I found out that they have about 50 individuals in private homes.
They do stuff to fix problems before we have to do stuff.
Yeah, so some of the 19 that we're counting are those single room in a home spaces, because there is payment to those families who are letting those kids come in, so.
It's almost like a foster family.
Yeah, of sorts.
Yeah, but it's basically like you're renting a room, but not necessarily.
Like a homestay, if anyone knows what the homestay model
Yeah.
looks like, yeah.
So fingers crossed that. Your funding and all that should within, how many,
We were initially told that we should have an answer by mid August, things, and we're almost there. And like I said, they've asked a full court press. They want ours as quickly, so we'll be filing ours today. And so, and we've had 2 additional technical assistance calls, and they've spent an inordinate amount of time with us. And so that's very positive that we're just not getting dismissed. They like what they see. They like our plans. They like the coordinated efforts. Able to, you see me take pictures at all these things I go to. The reason is I can tell stories. And so if any of y'all have ever been on my Zoom, you see my background keep changing. Well, that's what I'm doing. I queued them up for a reason, because it helps tell a story as I'm chatting. And then I'm like, oh, yeah, in fact, look, here is, well, that was planned. And so, but I'm trying to show them what's occurring here, because otherwise, the resources go elsewhere. The resources are gonna be doled out. It's time that they come to the Coos. And we have a mechanism to make it happen.
So we got two other positions to look at too, though, right?
Yes, that's in the
Number
next.
4.
That is the next.
Yes.
I guess the last little bit,
I have
but
one
we.
question first.
I actually, can I ask you a question?
Right.
Yeah, I feel like we need to be careful about staying the agenda and the public document part
Sure.
be at the beginning. Because it's 2:15 already.
Sure.
I mean,
It takes us.
yeah,
We need.
I was just gonna ask if we were gonna expect more funding if we do well.
Yeah, hard to say.
Say that some of that stuff can be asked at the end of the meeting so that we can get through the agenda. Yeah.
Cool.
Okay, so item number 4, from our last meeting, this is the additional support staff. From our last meeting, we talked about potential need for some additional support staff, and Andrew was tasked with working on some job descriptions. We thankfully had already a format from the county.
Looks familiar.
That was used to develop Andrew's
Thank you,
job
Bill.
description.
Sounded good.
Yeah. So essentially, we kind of Andrew and I worked together to kind of put these two, this is an administrative coordinator kind of position. And then the project manager role. And I believe the intention, and David probably can speak to this a little bit more, but the intention would be to, where's another set, sorry, Stephanie. Here's a set. The intention, I think, is to do much like Andrew is work that through Cardinal, so. We can definitely get these over. There's a few gaps. I wasn't certain because it is a county kind of thing. Essentially, we are looking for the admin person to really support any and all of the roles that would be within this. So that'd be Andrew, the grant writer, the project manager. They would be managing these meetings, helping coordinate communications and things to kind of help Andrew stay out in the front and be talking with folks like that. Program manager is really, so for example, we have this potentially funding coming to kind of help walk that path that the funding comes through. There's a few projects to make sure that they stay on track, because also a part of our request includes a calendaring of when those units are believed to come online, and we're going to be held accountable to that based on the quarters we've identified units to come online. So we need someone who's going to be making sure that walks forward timely to meet those goals. So I don't think we're necessarily at the point to approve these, but rather maybe take them and we can, unless you want to talk more about them and. move
Two
forward.
quick questions.
Yeah.
We listed the expiration as May of 24. Is that because we're not sure we'll get the funding again?
Grant.
Yeah,
That's what I figured. And then for the wages, it's 89,000 in total. Are these folks going to be entitled to benefits?
Well, they go, if we do through Cardinal, then the answer probably is no, because they don't have that through Cardinal.
Okay,
I mean,
I was looking at total cost.
yeah, and going through an agency like that there's a premium you pay, but then you have increased flexibility.
Yeah.
With the payroll.
That used like before, yeah.
yeah, and we're deeming, because we're not really necessarily this body, it's running through the county. These are more consultant type of.
And again, we're looking at program managers to help us stay on track. I mean, for any of these kind of projects, a lot of these organizations, they do the best they can, but if we have somebody sort of external, making sure that things are gonna happen.
Yeah.
But likely, and they can also help pitch in and get things done too, if there are roadblocks, which inevitably with these projects, there is something that you have to overcome.
We're on the hook for reporting, we're on the hook for the money, but we have to make sure that the success is there. That for the benefit of those in the audience, we already have day jobs. And so, we're here at the behest of our governing bodies and the mayor, even though she appointed herself. Well, that's an accident of everybody, but we're here because we're appointed. David volunteered and then realized,
I didn't know exactly what that entailed.
and so, so we're glad to have him here. And so, exactly. And so, so these are the folks that work in this office through the office. To actually make sure, that the work gets done, every penny is accounted for, and then all of the, reporting gets back, appropriately. Because if you're not good stewards, you don't get more money. And once you've been funded, the likelihood of additional funding is always beneficial and likely. I'm cool. I actually like these. And so I'll make a motion that we approve both the administrator coordinator and project manager position. And for the request to the appropriate county channel in order to get the positions authorized to start.
I'll second.
Right. Is there any further questions, comments? Hearing none, I will open the question. All those in favor?
Aye.
All those opposed?
Right, Madam
Motion
Chair.
pass. Yes,
One question. So once you get approval, you have to do posting interviews, all that good stuff. You want to make a call about the team for those that want to be on the interview panel for the positions.
sure.
And I have a recommendation.
All right, we'd love to hear your recommendation.
The recommendation is, since we do the weekly, you leave it to the electeds. I suggest.
I suggest that that's a bad idea.
And the alternate, and so that we have 4 folks that can be on the interview panels. Because we have
Stupid alternate.
Drew Farmer, we have Jessica Engelke, we have John Sweet, and then we have Stephanie Cullen.
You hear me, it put the emphasis on, I just.
What? So that was my suggestion.
And this, we would have an agency, that the candidates and bring us a slate of candidates.
Yeah, Cardinal will send everything over to you.
There you.
I think it'd be better if you, to whom these people will be reporting.
Do all of us, the 6 of us?
No, not the six.
Yes, the 6 of us.
Yeah.
No.
I mean, I do have a little bit of concern about timing, you know, I don't.
I'm concerned about being the president.
But you're not that here, you're an advisory. 41.3, and that is listed on ethics. And so your governing body is giving you a task.
We have an HR specialist. Don't stare at Jessica.
I was, my first response would be, I don't think so. But I need to put some more thought into it. Just-
We're covered by CIS individual.
Yeah, you're covered because of an action of your governing body. So yes, we are fully.
Yeah.
Yeah. Yeah, I can't speak for the airport, but her appointment is through the city. So she would be covered as well.
Yeah.
Yeah.
I can always ask.
Yeah.
I've got a meeting with them next week.
Yeah. Yeah, as long as it's in the role of your official capacity. Now, if I decide to go out and direct traffic,
Okay,
So, I don't want to commit to again that panel right now.
sure.
Some due diligence on that, but John and I volunteer.
And when do you expect this to happen?
Well,
Because.
what do you, I don't know what this project looks like.
Something I can't do.
Well,
To get it,
I mean, I'll find out, like, we're doing the same thing with the grant writer. We'll figure out exactly how that needs to happen, so.
It can't happen sooner than a month, though, I would
Yeah.
imagine.
Well, if we don't do a contract, we do it as a through Cardinal, it should be.
Oh, okay.
yeah. In the interviews, you're talking an afternoon or a morning. Because you only have 2 positions there. And so you whittle it down and you decide, you know, because Andrew does a matrix, all the background checks, Cardinal, everything. So you just have those. And then you decide, who you want to interview. Andrew goes ahead and schedules all those. Y'all show up. And, we'll even make sure you have donuts and coffee that day.
Really
Yeah.
objective series of questions.
Yeah.
And, so you're really talking a half a day. Which, y'all are busy, we're just as busy. So I need to spread the workload of
I'm sure we can arm wrestle each other for it.
So the advisory group is thinking 3 people or a 3-panel hiring committee. And then that hiring committee, 3 of the people on the hiring committee would make a recommendation
To the advisory.
Okay.
Yeah, so you'd have, what's it supposed, so you're talking like a month from now that we'd have to, as long as everything goes through the county and get advertised, that a month from now, will be the recommendation and then.
That's terrible time. The one that actually pays me. I'll put some thought into it. Was there any other volunteers for this advice?
I absolutely can, fit something in if it's not.
Myself as well. I
Concerned
mean,
about 4 of us being in a space and making. a
I think
decision.
David's point is try to share the wealth.
Yeah.
Since
Because
the
we
rest of
are
us need.
meeting,
We get every single week on this, plus our regular jobs. Yes,
plus
being fair,
a huge balance of state
Well,
effort. that's
yeah.
been-
it's been a lot of hours.
Yeah.
So, thank you.
We knew we could guilt you into it.
Will these be, middle of month, will these be held in Maine?
We can fly them in.
Okay, thank you.
Yeah, we have an
Make sure it
airport.
didn't- Vacation.
Okay, so we're. good with that.
So we have Stephanie on board, right? We have Drew, I have at least 3.
You wanna,
Why not? Andrew,
David also put up his hand. Yeah, let him.
did he?
Yeah.
You raise your hand?
Yes.
I was with.
he has that problem.
I said,
Oh, man, she was going to in bad.
John was.
She's just taking. We saw. Sucker.
I don't think you had this time for a report.
Yeah. We're gonna move
You
to
got 3 minutes.
agenda item 5.
See how quicker you make this.
Say it when times you need.
Okay, so last Thursday, we had our community resource meeting, our tribal members are involved with more representing the Poco Indian tribe. Do you have any of the veterans organizations there at that last meeting, but I'll talk more about that later, what I'll be doing next week at Point Village Mall. Then we also had law enforcement, appreciate the mayor being there as well, and Nicole and Christine. The city helps out with notes and stuff as well. Some of the things, one of the things we gotta do is look at a strategic plan, and I know Robert hit on that hard, where are we moving forward on that stuff? And getting information, so, we talked about the different platforms for technology coordinated with Ulster. And honestly, yesterday I attended the pastors meeting at Shoreline Community Church, because the pastors are very informed of those programs, and had Amanda McCarthy from Advanced Health, and then also Tara Johnson from the Devereaux Center talk about the different platforms of Unitas and Kentone. The pastors are gonna come back together to decide what platform they want to use, and that could be our model of our community resources of the pastors going with a program. Why would the pastor want to be part of that program? Well, if you attend a church, majority of the times in the city, you have homeless that come in. And they provide sometimes services with help with bill pay, help with rent pay, help with food services, clothing, different things going on. The problem is, for example, if a Jim Bob decides to go to some church and gets food and clothing, and then within the next couple hours, he decides to go to the other church in North Bend. With this program, this would show that they've already had services. And it's coordination and communication among the community resources, and then also with our county. So it went very well yesterday. So that's part of the strategic plan. We talked about, we always coordinate our services like was talked about today. And we've been working with the faith base. So one of the other things that is long-term that we're looking at for this strategic plan is working with organizations providing services to veterans. We've had a few organizations have come. And even for our community business stakeholders meetings, our faith-based meetings, and a few others. But I am doing outreach and helping out with the stand down event, and that's on Friday, next Friday, the 18th, where all the services of veterans resources will be there with the homeless veterans. And it's a day that they're able to find services and find out what's going to happen. And then by doing that, I'll get more outreach of what's currently going on with organizations that are helping out with these veterans, especially if they're homeless. So that's happening this Friday. So I kind of went over the long term. So we also talked about public transportation options. CCAT has moved forward. I don't know if you've seen lately on Facebook, but they did receive a brand new bus for their company. They are now having services for transportation on Saturdays now, and that's moving forward well. Like I say, if you're a tribal member, it might be from any tribe, but if you have a tribal card, you get free transportation on CCAT. And it also goes with the kids in the school districts. They show their student body card, they actually get free transportation right now. I don't know how long it goes till, hopefully for a long time. So anyways, that's going on. And they're always looking at different routes of where heavy areas are to find out, what's the best transportation needs. I think that organization is moving forward very well and doing very good things. So another thing we talked about, part of the plan is considering development support programs tailored at risk populations, especially with teenage and teenage mothers and what's going on there. So I've been working with Rachel Espy on that project, the SAFE project, and finding out what some of their needs are and have come up with some great ideas moving forward. This past Monday, I don't know if you have seen, we also are on Facebook and we have a county website, but I went and did shadowing and participated in a ride-along service for the city of North Bend, and it was with Officer White. I observed the time, place, and manner where homeless are able to be during the evening times. It was at the harbor majority of the time. And I met with the homeless people down there and seen how good our human resource officers have been communicated with these homeless people that are currently homeless right now. And that project is going well. And they are obeying the law. Sometimes it takes a little bit longer for them to get them going, but overall it's going really good. One thing I would like to share, for example, is, and it kind of touches on, there is a family that had just lost their house that lives locally. They've been in their car for a year, not a year, for a week. And they are looking for service. So I had mentioned, and also Officer White had mentioned, have you thought about the mission? Have you thought about some of these programs? Well, they have 2 cats. And that's another thing that we're looking at in the strategic plan is how do we work with some of the agencies that have animals? And so I'm currently working with Coos County shelter programs. They are seeing that problem as well. They did email me back yesterday to look forward and maybe meet with them to find out some great ideas of moving forward, because it is an issue that we're facing. So I was continuing on the routes there. I got to see some of the parks. It's cleaned up really good. One thing I do want to give credit to is those organizations that at least once a month have been going out and cleaning different parks. I think they're actually having a cleanup this Saturday in the city of Coos Bay. Might want to participate in it for a little bit. So people are helping them keep all the parks cleaned up. I think it looks really good. We were behind on McPherson, you're behind the tennis courts there, the parks that lead up to that area. It's been pretty cleaned up very well. And I want to give the kudos in City of North Bend on that and their work and with the officers of what they do. So that's a little bit of summary there. So we talked about meeting with the pastors on Tuesday. And then we're gonna be meeting with the faith base tomorrow here with the New March Center with just the pastors and those that are involved with the groups there. And we'll be talking about more plans of different ideas moving forward and recapping of what we had seen, and maybe we'll do a census of what program they want to use moving forward to work with our community resources. And that's kind of where I'm at today. I can continue, but I don't want to take too much more of your time.
All right, item number six is board comments. David, any comments?
I'm not huge wanting to focus on the data, but really, I mean, I think it's really important to recognize that if we're gonna have success, we need to identify everybody that's homeless, and we need to really have a place where we can kind of document what we're doing, who's doing what, so that when the next person comes, they can see what's been done, what needs to be done. We need some mechanism to really keep track of who we're working with. So trying to find some way that we have a shared communication platform. I want to give kudos out to both ADAPT, Bay Area First Step. They are starting to do that outreach out in the communities. And that's, I think, a good start. And I'm hoping that we can kind of help. They're doing it under their specific missions, which is really around addiction. Not everybody that's homeless has addiction issues. So if we can help though, and get them some other funding that could be larger around issues around homelessness, I think that's really a good bang for our buck and a good way to support organizations that are already doing some of the work. So that's
to continue on that, at the last Friday of the month, I am gonna be on the field with ADAPT all day with one of their projects there in Lakeside. And so I'm looking forward to seeing what they do for the homeless over there and what the needs are as well. Sorry about that. Nothing from me.
Commissioner?
I thought it was telling that Bob, who's been involved with this program, homelessness forever. You got some, you got the wrong guy here. I know, we have the right guy. Ask the question he asked first. I think we need to somehow or another, I don't know if he's going to do it, but be communicating. Little outreach, at least to the sponsoring entities.
Yeah.
I couldn't answer this question. So I haven't been here as much as I should. But no,
We've
I
talked about that too internally,
quite-
like having Andrew go to each of the entities quarterly, maybe, and kind of report back to them.
maybe even gets all this help.
Yeah,
Like, for
we've been
example-
doing it ourselves in this bay, like I've been. But that doesn't.
And things to add to that, I'm in meeting next week and doing a presentation at the Rotary, so I am doing some outreach, and then at the end of the month, I'll be doing a presentation for Salvation Army, we'll be having a town hall there, so.
Perfect.
I think it comes to our city council meetings and gives updates.
Yes.
So we just gotta get you.
You may invite.
Yeah,
Get
you
back.
gotta get them out to go feel it. It's a drive, but I'm told it's a non-competitive drive.
It's a very nice drive.
It is.
Very pretty. Like to do a daylight.
Or in the daylight. Yeah, I see deer on the side of the road.
Yeah, anytime there's a county meeting that you guys want me to attend, please email me, that'd be great to be involved over there, so.
Really send one of the ladies, they're prettier.
What's that?
Send one of the ladies, they're prettier.
Oh, okay.
To remove that last comment from our record. Because I don't think it meets the standards that we work under today, but I do appreciate it. Stephanie.
Just to continue with what you say, I think if we're gonna move anywhere, we need to have that. And the organizations that are providing service, because there's so much misinformation out there amongst citizens. I think you make very good points in having that data. I know that our direction when we had the homeless work group was we need to collect as much data when you're making our CROs or make contact with members of the homeless community. Because that's going to give us information. It's also going to help in education as well. As you said, not everyone is addicted, is homeless. We have working for who are, have no place to go at night. Other than their car or a sleeping bag. So, I'm not saying that's every situation, but I think all of that information is really key, and I like the platform.
I think one of the most ironic cases I had when I was working with homeless was I had a client that was homeless working in an assisted living center. They were working housing people and they had no housing.
So I want to say thank you to our director. I think he's been doing a really great job of implementing the strategic plan. Come to the city council meetings and I actually asked him to help with, I give out a committee, so I'm on the committee. I give out a committee report, and since he's going to be there, I asked him to articulate to our council what he's been doing, and I think that's really helpful. Because it's another avenue of that's a recorded meeting that gets pushed out that can hear that. So I encourage you, if, I don't think you have to be invited, to show up and do.
Well, just out of respect, it'd be, I don't want to feel like I'm stepping on each toes, and it'd be nice to be.
So. Because that's helpful and sure, the city council system, another way to communicate with women. And I'm sure said it best, if this was an easy solution, we wouldn't have the problem fixing it. So it's really big and with a lot of moving parts. And one of those things is the I've been just set with time, place, and manner, and been at it for a month now. And we had a town hall yesterday, and 6 people showed up. And although I always get my feelings hurt just a little bit that those aren't higher numbers, I actually think that that is a good number because it means that what we're doing is working in the city of North Bend to a certain extent. And so, those are all part of the pieces of the puzzle. And so I feel like we're making some movement there. But I appreciate everybody's hard work on this. I recognize that is another thing to your jobs and to my job and everybody else who has 5 other things that we're doing. But it's great to be surrounded by people who want to work on solutions and just not gripe about the problems that are in town. So thank you.
Right. Well, being nothing else, we'll adjourn the meeting.
All right.
Yeah.